Physio Web Series Knee Complex Season 1. Let's begin with Series 8. In Series 8, let's learn about the patellofemoral joint, the articulating surfaces of the patella on the femur, as well as the movement of patella during the knee joint movement. So let's have a look. As in this diagram, we can appreciate the patella articulating with femur present at the femoral sulcus. So this is lateral condyle, this is medial condyle, and this is the sulcus where in normal knee extension position the patella sits on this femoral sulcus. And when this patella is reflected as shown in this diagram, so when this patella is reflected, here we can see the articulating surfaces. So on femur it was somewhere here. So this is the notch of femur. Again, if we consider, this is the lateral and this is the medial side, and this will be the lateral facet of patella, medial facet. On the medial side there is odd facet. We will be seeing in detail about the articular surfaces of patella, but as over here we can see, as the patella is reflected, it was placed over here as the articulation. Now continuing with the articular surface of patella, as we can see, anteriorly we can appreciate the base and apex of patella. Posteriorly also there is this base, and this will be the apex, which has the attachment of patellar tendon. And now we can see, if this is patella, there is a vertical ridge. One side there is medial facet to the medial side, then here is the lateral facet, and on the medial side there is odd facet at the edge of the medial side of patella. Here we can see how is the articulation. This way the patella was, and it is just flipped upwards, which can be seen over here clearly. So this is the apex of patella, which will be somewhere over here, and those are the lateral and medial articulating surfaces which will be present over here, with the odd facet at the medial side. So the lateral facet of patella with the lateral condyle of femur, medial facet of patella with the medial condyle of femur, and in between there is vertical ridge. This is the base, this is the apex, and somewhere over here will be the odd facet as shown over here. So this was about the articular surfaces of patella. Now let's have a look at a concept or a fact, that the posterior surface of the patella sits on the femoral sulcus, which is the anterior part of the distal femur, in extended knee. When the knee is in extended position, the posterior surface of the patella sits on femoral sulcus. And over here, as you can see, you can appreciate, if somewhere over here the patella sits, it is on femoral sulcus. It is not occupying this notch or intercondylar groove where it will be mostly engaged with the femur. But in knee extension it is not over here. It is present over here in the femoral sulcus. So because the patella has not entered the intercondylar groove, hence the joint congruency in this knee extension position will be minimal, and therefore there is greater potential or greater risk for patellar instability with knee near full extension. Over here we can appreciate that at what ranges what part of patella is in contact with femur. As we can see, at 20 degrees of flexion, this inferior pole is in contact, the lateral and the medial facet, some part of it, then 45 degrees, and then at 90 degrees we can see the lateral and medial facet is in contact, the superior part mostly, and as it reaches till 90 degrees, somewhere reaching towards 90 degrees of knee flexion, the patella will have most of its contact with the femur at this position. And as there is 135 degrees of knee flexion, full knee flexion, at that time the lateral facet is in contact with the femur, as well as the odd facet is in contact with the femur. The medial facet has no contact with the femur, as we have to remember one thing, that Only the lateral facet and odd facet is in contact with the femur, of the patella is in contact with the femur. So that is the point to remember. And also, as we know that at full flexion can be seen over here and appreciated over here, if this goes in flexion this way, the tibia moves in flexion. So as it is approaching flexion, starting from here at the femoral sulcus, more down, more inferiorly, and at the end, full knee flexion 135 degrees, the patella is lodged into this intercondylar groove. And contact is on lateral and odd facets. As we discussed, the contact, if this is the vertical ridge, this is the lateral facet, medial facet, and this is the odd facet. So the contact is on lateral and odd facet. Medial facet completely out of contact. Okay, so the contact is only with the lateral facet and the odd facet. Point to remember. This happens at full knee flexion. Now let's have a look what is this insal salvati index. So there is a ratio of length of the patellar tendon to the length of patella. Suppose if this is the femur, this is the patella, and this is the tibia. So there is quadriceps muscle with its tendon inserting to patella. Then there is patella and patellar tendon inserting to the tibial tuberosity. So this is the pathway. Now the length of the patella and this patellar tendon. Okay, length of the patella and the patellar tendon. The ratio of the both of these things, the length of patella and patellar tendon, is 1:1 in normal conditions. But what if this length of the patellar tendon is abnormal? If it is increased or it is reduced, then we can see patella alta and patella baja. So let's have a look now. Patella alta means markedly long tendon. The patellar tendon which we saw, it is markedly long, which produces abnormally high position of patella on femoral sulcus. So there is increased risk of instability. Point to be noted. So in this diagram, we can appreciate the normal patellar alignment over here. Now in patella alta, we saw the patella is little at higher position than the normal one, because there is increased length of this patellar tendon, and because of that patella is at higher position than normal, which will increase the risk of stability. I mean to say increase the risk of instability. Patella will be more unstable in this case. Also there is patella baja, where patella is positioned more inferiorly. Opposite to alta is the baja. So that may be due to the shortened position of the patellar tendon. Again can be appreciated in this diagram. This is the normal patella, and here due to the shortened position of this patellar tendon, the patella is pulled or positioned slightly inferiorly than this. We can just see this is the normal one, and how in patella alta the patella goes to higher position, occupy the higher position, and patella baja, the patella occupies the lower or inferior position. So that was about patella alta and patella baja with the index, insal salvati index, where the ratio is 1:1 of the patella tendon and the length of patella. Now moving on to movements of patella or patellar motions, starting with patellar flexion. So with knee flexion, where the femur is fixed and the moving part is the tibia. So if we imagine here like this as shown in this diagram, so the tibia is going to flexion, flexion and flexion. So we can see the position of patella as in 20-degree knee flexed, the patella is somewhere here upwards and it is gliding downwards slowly as the tibia is moving in flexional position. So it is gliding like this, and then more inferior glide is there. So when femur is fixed and tibia is moving in knee flexion, the patella will glide inferiorly and rotate on femoral condyles, as can be seen in this diagram. So the patella is gliding inferiorly and rotating around this femoral condyles. So we can appreciate that if this is the suppose lateral side of the patella, this part. So this will be the apex. This part, the inferior part, is the apex. So we have to judge according to the apex. So as the distal apex of patella moves posteriorly, this way, posteriorly in sagittal plane. So this is the sagittal plane rotation of patella during knee flexion where the tibia moves. Can be appreciated over here also, like we are seeing the lateral view in this diagram. So the patella is somewhat like this. This is the apex. This part is anterior. This part is posterior. If the apex is moving downwards and going this way posteriorly, rotating posteriorly and gliding downwards, that is patellar flexion. So we can see the apex is going posteriorly. That is, it is doing sagittal plane rotation. So in knee flexion with fixed femur and moving tibia, we can see patellar flexion, where the patella glides inferiorly and rotates in sagittal plane rotation around the femoral condyles. After patellar flexion, what is patellar extension? Opposite to this. So when femur is again fixed and the tibia is moving into extension, the patella will be gliding superiorly, as can be appreciated in this diagram. So now the tibia moves in knee extension, that will bring back the patella to its original position on the femoral sulcus. So can be appreciated over here, like in full flexion it was an intercondylar notch. Now as knee is extending, so patella is gliding superiorly, like this, finally like this, where it will go back to the femoral sulcus, its original position. So patella is gliding superiorly up and around the femoral condyles. That was about patellar flexion and extension. So with knee flexion and extension, patella will glide downwards and upwards respectively, where the tibia is moving and femur is fixed. Now moving on to lateral patellar tilt. Patella tilts about the longitudinal axis. We can appreciate if we consider the lateral tilt. So this is the normal position of patella and the patella is tilting laterally, this side, as this is the lateral side and this is the medial one. So in this patellar tilt, the anterior surface of patella moves relative to femoral condyles. So we can appreciate the femoral condyles over here. And this is the anterior surface of patella. Now this anterior surface of patella tilts either ways. If it is tilting laterally towards the lateral femoral condyle, that is the lateral edge of the patella approximates with the lateral femoral condyle. This lateral edge is approximating with the lateral femoral condyle. That means lateral patellar tilt is taking place. Now vice versa, there will be medial tilt of patella. So this is the normal position in the center. Patella is occupying its position at the femoral sulcus. Now as the medial tilt will occur, the medial edge of the patella is approximating or making contact with the medial femoral condyle. So that is medial tilt, where the anterior surface is moving towards the respective condyle. If it is medial, then it will be medial tilt. If it is lateral, then it will be lateral tilt. And in tilt, the corresponding edge of the patella will approximate or make contact or move towards the corresponding condyle. If it is medial, as in this case, then will be called as medial tilt. Again, we can see the medial edge of patella coming towards or moving towards the medial femoral condyle. So that was about tilt. Now coming to shift of patella. So during knee flexion extension, also along with the superior and inferior gliding of patella, there is shift of patella along with it. We'll see that later on. But now, isolating the movements, we are continuing with lateral patellar shift. So what is this shift? Shift is basically just a translation, this way or this way, laterally or medially. So as can be seen in this diagram, the patella when glides this way, like this is the original position of the patella. If it glides or translates this way to the lateral side, that will be lateral shift. If it glides or translates or it moves towards the medial femoral condyle, then it will be medial shift, and this will occur in frontal plane in medial lateral axis. So that was about lateral and medial patellar shift. Again can be seen over here this way. And one important thing to remember is that lateral patella shift is commonly used during patella apprehension test, which we physios perform. We have a magic tool, a key, which physiotherapist has to identify or diagnose the problem of patient. So there is a patella apprehension test where lateral patella shift is commonly used to evaluate the stability of patella within the femoral groove. So this is one thing to remember. In patella apprehension test, we evaluate the stability of patella within the femoral groove. Okay, over here. And for that, we use lateral patellar shift. Okay, so now moving on to patellar rotation. Rotation occurs about an AP axis, antero-posterior axis. So there will be lateral or medial rotation of patella. And there also we will observe the distal apex of the patella. Apex is distally. So we will observe the apex of the patella, how it moves. If the apex of the patella, as can be seen in this diagram, so the apex of the patella, this is the center position. Now the apex is over here to the lateral side. Apex is moved over here to the lateral side. That means the patella is rotating to lateral side. Okay, so the apex is towards the lateral femoral condyle and the base is slightly towards the medial femoral condyle. Can be appreciated, like this is the center position and this is so this is the center position somewhat. This is the center position and now the apex of the patella has moved laterally and the base is moving medially, which is in this diagram. Can be clearly appreciated. The apex is going towards lateral femoral condyle, base to the opposite. So the distal apex, which is moving towards the lateral femoral condyle, will note that it is a lateral patellar rotation, and opposite to that will be, see, the apex moving to medial femoral condyle is the medial patellar rotation, where the apex of the patella is pointing towards the medial femoral condyle and base to opposite, that is lateral femoral condyle. So patellar rotation is in antero-posterior axis. Now let's have a look at this concept. So during knee flexion and extension, as we discussed, patella glides or moves inferiorly and superiorly. Flexion may inferior glide and extension there is superior glide of patella. Simultaneously there is shifting of patella medially and laterally. So with the knee in extension, we have to remember, with the knee in extension, the patella is slightly laterally in the femoral sulcus. So if this is the lateral femoral condyle, with the knee in extension, patella will be slightly laterally. It is normally placed slightly laterally in the femoral sulcus in knee extension. So as it is placed slightly laterally in knee extension, now as the knee flexion begins, as the knee flexion is initiated, this patella from its lateral position in the femoral sulcus is pushed medially by the large lateral femoral condyle as knee flexion is taking place. So initially it was laterally placed in femoral sulcus. As flexion is initiated of knee joint, that patella is pushed medially by that large lateral femoral condyle. That is, see, in this diagram, the knee is in extension position. Now as the flexion will begin, this laterally placed patella on the femoral sulcus will be pushed or shifted medially by the large lateral femoral condyle. So this is clear with this diagram. And as the knee flexion past 30 degree occurs, more than 30 degrees of knee flexion takes place, that time patella will move again laterally as it was placed before, or else it can remain stable over there. So this was a biomechanics part added. So there is a thing to remember that in knee extension, patella will be placed slightly laterally in the femoral sulcus, and after that, as the flexion begins, the patella will be pushed medially by large lateral femoral condyle.